Hello guys, this is Dr. Possibility from Excel Academy. Kindly take note that Excel Academy will be offering physical classes both at main campus and also at Ridgeway campus. So make sure that you register with us and make sure that you subscribe to our YouTube channel for more videos. So in this class, I'm just going to explain few concepts using multiple choice question from different past papers. So make sure that you follow up until the end of this tutorial video. So my first question is, which plane divide the body into anterior and posterior part? So we need to understand that the body is divided into different parts using what we are calling the planes, and these planes are just imaginary lines. I'm aware most of us can remember from secondary school, primary school, where we talked about two important lines which we can talk of attitude and longitude lines. So even the body has imaginary lines. So there are three important lines that we can consider. The first line that we can talk about is the sagittal line. So when you talk of the sagittal line, this is the line which passes through the suture between two parietal bones. And the name sagittal is coming from that suture which is between two parietal bones. Then we can also talk about the other line, which is the coronal line. So the coronal line, it just actually gets its name from the suture where it passes. And this suture is a suture which is between the parietal bone and the frontal bone. And these bones are just found in the skull of a human being. The other important line which we can talk about is the transverse line. So when you talk of the transverse line, this is just a line which is perpendicular to both the sagittal line and the coronal line. And this line is normally separate the body into the superior and inferior region. Just in case you are not familiar with anatomic terminology, when we talk of superior, we're just talking about the upper part of the body, such as your head. When we talk of the inferior, we are talking about the lower part of your body, such as your leg. If I was to be more anatomic, I can say your head is superior to your legs. Alright, so let's get started and quickly look at this question. So the first option is sagittal, the next one is coronal, the other one is lambdoid, and the last one is metopic. So the best answer on this option is the coronal line or the coronal plane. So the coronal plane is just a plane which is passing through the suture between the parietal bone and the frontal bone. And this is just a line which separates the body into the posterior and the anterior. Okay, let's quickly look at what these two terms mean. So when we talk of anterior, anterior just simply means front, the front side of your body, such as your chest, which can also be said as the pectoral region. Or we can talk about an important bone which is found on the anterior side of the body. And this important bone we can talk about is the sternum. The other term which is in this question is posterior. Posterior simply means back. I'm sure during your dissection, you'll be talking about the posterior muscles. When you talk of posterior muscles, these are just muscles which are found at the back region of your body. And these muscles can be classified into three types. But I'll not go much in detail because we'll look at that in my tutorial video of dissection. Let's quickly look at the next question. Which plane passes through the suture between the parietal and the frontal bone? Remember, I just talked about these important lines. One of the line which I talked about was the sagittal line. So this sagittal line is a line which is passing through the suture between two parietal bones. It's passing through the suture between two parietal bones. And when you talk of the coronal line, which is separating the body into into the posterior and anterior, this line is normally passing through the suture between the frontal bone and the parietal bone. The frontal bone and the parietal bone. So let's quickly go on my next part, which I can use the diagram to explain. So this is the human being, and this human being can be separated into two parts or more parts using these lines. So the first line we can locate here, it is the coronal line. So this is the coronal line, and the coronal line is simply dividing the body into posterior, which is the back, and anterior, which is the front. The other line, which is the median line, this is the median line, and this median line is also known as the sagittal line. So the sagittal line is just separate the body into two equal parts, the left and right. The last line which we can talk about is the transverse line. So when you talk of the transverse line, this is the line which is marking the body into the superior and the inferior. Into the superior, which is up, and the inferior, which is down. And if you observe, this transverse line is perpendicular to both the coronal line and also the sagittal line. It's perpendicular, meaning it is forming 90 degrees angle. Then there is an important line which is known as the mid-sagittal line. A mid-sagittal line is any line which is other than the sagittal line. And this line normally doesn't cut the body into two equal parts. The next one we can talk about is this question. So we have what we call the anatomic position, the best way the body should be for us to describe that it is in anatomic position. For example, when someone is standing in an erect position, that person can be said to be anatomic position, but that doesn't mean that that's enough for that person to be said in, or to be said that they are in the anatomic position. Now the question is, how can we know that the person is standing in the anatomic position? 1, the body has to be erect. 2, the eyes have to face away, which is forward. And the other thing that we can talk about is that the palms have to face forward. Then that person can be said to be in anatomic position. Let's quickly look at the multiple choice. A, the body in supine position. No, this is totally wrong. Why? Because the body is not erect. The other one is arms abduct, which means the arms have been added, which is also not anatomic position. But the third one is the best answer, because this one is in line with the rules that govern anatomic position. Let me quickly use few concepts using the diagram so that you guys can be able to understand. So if you look at this person is looking away, like at a certain distance, and this person is looking forward. When you look at the way the person is standing, this person is in an erect position, meaning is standing upward. When you consider the palms are literally facing forward, so as the feet and these feet are normally close together. So this is the back view of the anatomic position. So let's look at the rules for us to consider that the person is in the anatomic position. Rule number 1, the body has to be erect. This simply means that the person is not supposed to be sleeping. When a person is sleeping, he or she can either be in the prone position, whereby they are facing downwards, the chest is downwards, the abdomen is downwards. When you talk of the supine position, this supine position is whereby the person is lying down, whereas their face is facing forwards, meaning they are sleeping on their back. The other rule which I simply talked about was the person standing straight. When a person is standing straight, just like this one, that simply means they are in an erect position. Then the eyes need to look forward, just like I said in the question. For example, when I'm looking at something which is 2 meters away from me, then that is obeying the rules of anatomic position. The last one is that the feet have to be together and the palms have to be forward. That's all about the anatomic position. Remember, for you to relate the body parts, you need to have knowledge of the anatomic position. Anything which is not obeying these rules, for example, when a person is in the prone position, they are not in the anatomic position. That's why that position has its own term, which is the prone position, whereby someone is facing downwards. Supine, someone is facing upward. There is also another position which is very important when we are delivering a baby, and this is known as the lithotomy position. So the lithotomy position is one of the important positions. As a medical student, you need to know it because it's a very important position when you are dealing with a maternity issue. All right, let's quickly look at another term of interest. So the question is, turning the sole of the foot medially is known as what? 1, inversion. 2, plantar flexion. 3, inversion. 4, dorsiflexion. The first inversion, this is whereby you're moving the body laterally. You are turning the sole of the foot laterally. And then when you talk of this one, which is our answer in this case, this is whereby you are turning the body medially. So when the sole of the foot moves medially, medial, meaning it is moving toward the sagittal line, in such a case, the foot is said to be inverted. This is a very important movement or term in anatomy. For example, there are people who have conditions such as a club foot. So when you talk of a club foot, this is whereby the sole of the foot is being rotated or turned medially. So this is very important for you to understand. So when the sole of the foot is turned medially, for example, in a case of a club foot, such a foot is said to be inverted. Now, when the sole of the foot is turned laterally, that simply means that away from the median line, away from the sagittal line, such is said to be inversion. All right, let's quickly look at the other question. This is just actually what I've been talking about, inversion, like this one. So in this case, the body is moving. Remember, we have the sagittal line which is moving somewhere here, which is cutting this body into 2 equal parts. So when the sole of the foot moves in that direction, this is known as inversion. When the sole of the foot moves in that direction, which is laterally away from the median line, it is known as inversion. Okay, let's quickly look at another term. Structures that are on both sides of the body are said to be 1. Ipsilateral, 2. Contralateral, 3. Medial side, 4. Bilateral. When you talk of this term, when you talk of ipsilateral is just talking about same side of the body, same side of the body. That's where you can consider ipsilateral. Contralateral, you are talking about opposite side of the body, opposite side of the body, opposite side of the body, same side of the body. Then contralateral, it simply means opposite. Contra, it's just coming from the word opposite or on different side. And then when you talk of ipsilateral, it's just talking about on the same side. Bilateral, that means on both sides. As a result, this is the best answer in this question. Bilateral. Bilateral means the certain part of the body is on both sides of the body. The next question is, which of the following correctly described? The first one is, the scaphoid lies in the distal row of carpal bones. The next one is, the appendix is superior to the transverse column. The other one is, the triceps are contralateral to biceps. Then we can talk of the last one, which is simply talking about the tricep being Alright, so let's quickly continue from where we ended, and sorry for that disturbance. So the question we were at is, which of the following is correctly described? So the first one is, the scaphoid lies in the distal row of carpal bones. The next one is, the appendix is superior to the transverse column. The other one is, the triceps are contralateral to bicep bronchi. Then the other one is, the brachial artery lies medial to the bicep. So one thing you need to understand is that you need to make sure that you are so careful when using these terms. So the first one, the scaphoid lies in the distal row of carpal bones, which is wrong because the scaphoid is on the proximal row of the scaphoid. The appendix is superior to the transverse column, which is also wrong because we know that when the body is in an erect position, the appendix is inferior to the transverse column. The triceps are contralateral to the bicep. No, the answer is that the triceps are on the posterior side of the biceps. Then when you talk of the brachial artery, which is found in the axillary region of the body, this guy is found in the axillary region of the body. So this axillary region of the body is close, or it is close to the median line or the sagittal line. And when you talk of the bicep, this guy is a little bit away from the median line. So in terms of the relation, you need to understand that the bicep tendons, actually the bicep tendon is coming from the bicep muscle, because we know that the bicep muscle is normally sends two tendons. As a result, it is known as biceps. Triceps, it has three tendons, sorry. All right, so the correct answer in this case, it is this, which is D, because the brachial artery lies medial to the bicep tendon. Okay, the next question we can talk about is, clubfoot is a condition in which the sole of the foot is being what? Inverted. I'm sure I already explained about this condition using the other question which I was explaining about inversion. So this is just a condition in which the sole of the foot is being inverted. Okay, let's quickly go on the next question. A combination movement of flexion, extension, abduction, adduction. I think the friction is whereby you are moving away from the axis. Extension, you're about to move toward the axis. Abduction, you're moving away from the median line. Adduction, you're moving towards the median line. So these terms are very important, and I encourage you guys to make sure that you register with Excel Academy, because we are going to orient you, we are going to teach you on how you can use these terms and how the exams are set. Remember, these are just part of exam questions. There are more exam questions that we can use to explain these terms, and most of these will be discussed during our physical classes. So the first option is rotation. Next option is lateral bending. The other one is circumduction. So circumduction is the best answer for this question, because the question is simply explaining the body movement, which is circumduction. All right. So I can show this using the picture. So this is circumduction, whereby the body face need to be flexed, extended, abducted, and adducted. First, it is flexed. Next, it is extended. Then it is abducted, and lastly, it is adducted. In this order. So make sure that you know the order: flexion, extension, abduction, and then adduction. That's the order of circumduction. So make sure that you register with us. Make sure that you contact me on my line that I'm going to give later. All right, let's quickly look at this important question. When the elbow is stabilized, so you know we have different joints. We have the shoulder joint, we have the knee joint. Now at this moment we are talking about the elbow joint. Okay, so when you talk of the elbow joints, this is where now we have the three bones coming together to make this joint. You have the humerus, we have the radius, and you have the ulnar bones. So these three bones, ulnar bone, radian bone, and also the humerus, they come together and they make this important joint, which is the elbow joint. All right, so when this elbow joint is stabilized and you turn your palm upward, what does that mean? That simply means that you are supinating, and that's the best answer in this case is supination, because the palms are facing upward, meaning that you have used two important muscles here: the supinator muscle, which is on the anterior region of the forearm, and also you are using one important muscle, which is the bicep bronchi muscle, which is also helping in the supination of the elbow joint. Then the other thing that you need to understand is pronation. Pronation is just the opposite of supination. In this case, you need to understand that now the palms are facing downwards. So let me quickly look at the diagram. So when you use the diagram, you find that the palms are facing upward. So since they are facing upward, we can say they are being in the anterior part of the body. That's for supination. They face anteriorly, which means they face upward. Then when you talk of pronation, they are just simply facing downward. So all these actions, all these body movements are very important, and all these body movements, they happen because of the help of so many important structures. You can talk about the muscle tissues playing their role, whereby let's say you want to supinate, you need to understand that the muscles, both the flexors and the extensors, are playing a role. Also supinators, such as the spinator muscle and also the bicep bronchi muscle, it also playing a role. Even when you talk of the circumduction, which is involving flexion, extension, abduction, adduction, that are taking place all because of the help of both the bones, the joints, and also the muscles. Now, one important structure which helps in these things to move can also be talked about, which are the nerves. So these nerves, they simply innervate the muscles and they help the muscles to do their actions. Remember, these muscles can be classified into different types. We have the skeletal muscles, we have the cardiac muscle, and we also have um the other muscle. What's this muscle? Skeletal muscle, cardiac muscle, and the smooth muscles. And as a medical student, you need to understand which one has the action of voluntarily and which one is involuntary, and how the alignment, and which one has striation and which one doesn't have striation, which one is mount nucleated and which one is not mount nucleated, and which one contains the intercalated disc. So all that will be explained in the other tutorial video. In the meantime, thank you very much for joining me. Make sure that you subscribe to my YouTube channel. Make sure that you register with Excel Academy.